Population health management is more than an expanded version of utilization management. Jay, is that fact or fiction?
Thank you, Valerie. Yes, it is a fact. And if you'd asked me about 6 to 7 years back, my answer would be different. When population health was more a payer-driven, initiative or health plan-driven, where the focus was mostly on improving utilization. Now, with the healthcare system transforming to value-based care and becoming much more provider-driven, with providers involved in the whole process, it's becoming more of an outcomes-driven process. In fact, let me share with you the framework one of our customer healthcare system uses to describe population health to align the different stakeholders. So they use the AAM Institute of Healthcare Improvement AAM picture that I'm showing out here. And the way they describe population health internally is on the one goal is about reducing cost. And this is where your focus is on the utilization management, the traditional case management, medical variation reduction. So it's all about reducing the cost, and that's what most of the historical focus has been. But now with the value-based care, where you are focused on keeping the population healthy, now you're shifting and focusing as much on cost avoidance and risk management. And finally, the third leg of the whole AAM objective is about the whole patient experience, the quality of care and the patient engagement. So now if you ask most of the customers, whether they're payers or providers, population health has become much more than utilization management. It's about outcomes management. It's about quality of care management. It's about risk management. So you need to be hitting on all cylinders in order to take care of your population and do very well under the new value-based care. So let me share with you how you're addressing the different populations under the new paradigm of population health. So this is, some of you must have seen this in our publications, but this is how we describe. If you want to understand the state of your population, you can take any of your population within a health plan or a provider network and then plot it on a 2x2 grid, where on the x-axis you can plot the members per member per month cost or the outcomes. On the y-axis, you plot them on their clinical risk. It could be disease-specific or a composite clinical risk. And if you look at the 4 different quadrants, the critical category is where you are talking about members who have high clinical risk, different disease conditions, different comorbidities, and they also cost you a lot. This is where you're talking about case management, to focus on readmissions, transitions in care. And then if you look at the high utilizers, this is where you're talking about identifying those members that are high cost, but you scratch your head because you don't understand the reasons from a clinical perspective. But there could be a lot of non-clinical factors that could drive this high cost. It could be access to care issues or socioeconomic issues, that instead of someone going to an urgent care or a primary care physician, they're going to ER. So that's where you see ER abusers, or you could see some pharmacy misutilization going to the ER. So the right side has been the most focused for a lot of traditional utilization management. But now, if you look at the other quadrant, the hidden risk, where you're talking about high clinical risk but low cost, it's just a question of time. If you don't manage this cohort, you're going to see them move to the right and become high cost. So the focus on that hidden risk, now you're looking at cost avoidance, risk management, proactive disease management initiatives. And ultimately, the 4th quadrant being the healthy and the unknown, the focus out there is now how do you keep the population healthy in terms through wellness programs. So the key is to understand the different cohorts and trying to put the different programs. And that's the reason where, depending upon how you look at it, the population health now is focused on all the 4 quadrants. Every member in your population is under some into one of the quadrants and under one of the programs. So where is the focus there? So we use what we call the population health maturity model to understand where the health plan is or where the health care provider, healthcare system is. And it's interesting that we find through our huge gamut of customers, depending upon where they are on the maturity curve. the ones who are early on into the value-based care, like somebody who just signed on to a Medicare ACO, tends to focus a lot on the quality of care. They're focused on the quality measures because it is a must for them. It's a beginning to even, be a part of a value-based care. But that is just the beginning. But as you become, start reporting on the quality, you become more advanced and mature. You're now focusing on the utilization side. You're focusing on use cases like, how do I avoid network leakage? How do I, reduce cost through, avoiding readmission? And then as you get more mature, you're now looking at the whole problem as outcome. If you can focus on the outcomes, you can then, if you do it the right way, you can even affect the quality as well as utilization. And you're talking about now outcomes as a way to focus upon the quality and the cost and the AAA aspect. And finally, once you get to the fourth stage of maturity model, and as you advance through this, your financial impact is also much higher, and you see those in the fourth stage have a much superior financial performance compared to the ones who are in the early stage. And we identify this fourth stage members where once you start hearing providers talk the language of medical loss ratio, so it's like the providers talking the language of the payers and the payers start talking the language of the providers. That's where you see the total fusion and I would say the evolution of an organization. And so that's where everybody, I think, is leading to. And this is how we see population health maturity happening and the evolution of population health maturity.